it was the first thing that we thought about was the impact on the people that we work with, particularly people with intellectual disability who've got, with or without mental health disorders. Particularly at the time of isolation, we have to understand that the impact on them is profound. They just can't tell us. Families, particularly parents and carers, try to get as much activity that resembles what they were doing beforehand. So, we were allowed to do walking, we were allowed to go outside. It was really important to do that. If they were going to work 4 or 5 days a week, it was important for that person to have some routine. So when you wake up in the morning, have breakfast, we're going to go do the gardening. And then we're going to have lunch, and then we're going to, do some other activity. So they weren't just sitting on the couch doing nothing. Boredom comes idle thinking, comes a sense of hopelessness. And for some people with intellectual disability, they're more vulnerable to anxiety and depression. We need to think of a plan B, we need to think of a plan C, because just accepting that you're going to do nothing is not the option. For work is one of the places they have the most social interaction. So, most of the people I work with, and I'm sure most of the families can say that, their son or daughter isn't hopping on the laptop, going to Zoom and talking to their friend, on the other side of Brisbane and chatting about what they're going to be doing. A lot of them, that needs a lot of initiation, but it doesn't stop the parents going, we can organise that. Whether it's a laptop, whether it's a phone, whether it's a tablet, whether it's Zoom, whether it's face-to-face for brief periods, but also it is a time to look at the routines. So if you can't go to work 5 days a week, what can you do in the meantime? So if you can go 2.5 days a week, okay, do that. Well, what are other opportunities? Doesn't mean you can spend more time going to the gym. Doesn't mean more, you can do more arts class. So I think it's a really challenging time. I don't think there's a really straight answer other than there are resources. So, the interesting thing is when the COVID crisis emerged, the federal government increased the funding to Medicare. So people could access by telephone. So they didn't have to come to our office or say a psychiatrist, a psychologist. People could ring up or do video conferencing, and the Medicare increased the sessions from 10 to 20 a year, particularly, and that's currently in place in Victoria particularly. So it's increased the resources for people to make sure that they did have someone to talk to who had those abilities, the skills.